We're here with Public Health Director Alice Harvey for another question and answer session. We haven't done one for a while, so it's good to kind of get an update and see what's going on. Thank you, Alice, for taking the time on a Friday, a busy week for everybody. Let's talk about flu shots.
Okay. Yes. And I'm sure many of you already know this. We had our first drive-through clinic in Meeker last night. It was a overwhelming success. We vaccinated over 105 people. We were really excited to see everybody turn out, a range of age groups as well. So we are really hopeful that not only will that protect people from the flu and go a long way to our goal of getting more people vaccinated this year, but also it was a good practice run for a COVID vaccine. So it was really encouraging to see that it worked for our community and it seemed to be very smooth and efficient. So it's really important, of course, that people get their flu shot this year. So we want to encourage people to continue calling us to make it. You can come in and make an appointment for a flu shot individually. We're doing a variety of community site clinics. So we will be at the schools as well in both Meeker and Rangeley. We have our drive-through in Rangeley next Tuesday evening at Public Health. And then we'll if we have enough vaccine left over, we might even do a second drive-through clinic at the end of October in both locations again. So we'll see. We have received a lot of extra doses. We planned ahead last year, obviously pre-COVID, to try to do more flu vaccinations anyhow. But then with COVID here, we are motivated even more so to vaccinate more people. And there's a couple reasons for that. It really boils down to hospital capacity. Obviously, most importantly, respiratory health. So, the obvious answer is you definitely don't want two potentially deadly respiratory viruses at the same time. So that it's a good idea to get your flu shot for that reason. But the other is that we want hospital beds and ventilators available for COVID patients should we end up having some that are really sick. So in terms of like the CDC, they conduct studies every year that helps to sort of measure the benefits of seasonal flu vaccination each season to determine how well flu vaccines are working. And what they found and what is known in the communicable disease scientific community is that flu vaccination reduces the risk of flu illness by between 40 and 60% amongst the overall population. But also getting the flu shot decreases your chance of getting severe symptoms. So you're not only less likely to get it, but you're also less likely to end up in the hospital. And, most importantly, again, it goes back to community health. Getting your flu shot also means you're less likely to give it to someone whom it could be serious for. So pretty simple. There's lots of statistics and data I'm always happy to share with folks. And then in terms of safety, the flu shot's very, very safe. I'm always happy to share information with folks that are concerned and encourage people, to ask questions. And definitely, I'm happy to answer questions for anyone who's concerned at all, and then make appointments to get everybody vaccinated.
Have they come out with any kind of prognosis, I guess you'd say, for how effective the flu shot is going to be this year? I know some years are better than others. It really fluctuates, and they won't really know for sure until well into the season. Mm-hmm. So we actually have a lab, Grand Junction is one of the labs nationwide that does submit samples to the CDC for folks that are positive. And so that's how they develop the flu vaccine. It's by isolating the most common strains from the year previously to try to guess which ones will be prevalent. So we never really know until we're in the thick of it. But hopefully we'll have a good year. Yeah. I can't remember Australia. I think we usually seem to mirror what happens in Australia. And it seems like this year was not a really bad year for them, which would be helpful. It'd be helpful not to have two giant things going on. Mm-hmm. And then let's, so with flu shots, what is the age range that's recommended? How young, how old? So 6 months and up. In fact, we highly encourage babies to get vaccinated after 6 months. It's also really important to get your baby in as soon as possible because when they are first vaccinated as an infant, they'll need a booster in 30 days. So you really ideally want to be fully vaccinated by the end of October. So if you haven't already, get your baby in for a shot. So then also, of course, we can give flu shots, and we encourage flu shots for the entire lifespan, and definitely folks who are over 65 and anyone who has an underlying health condition as well. It's also even more important to get your flu shot.
Particularly respiratory, like asthma or
Yep.
something along those lines. Okay. But we're of course still wearing masks, still complying, still trying to prevent the spread of germs. What's the latest data on masks that you're hearing? And are they making a difference?
Yes, yes, they are definitely making a difference. And we do have data from all over the world. So the most recent projections are show that it really depends on the correlation. And actually, I do have a website I can share after, or maybe on the post. I won't share my screen, where you can play with the numbers. So if 95% of the population began wearing masks in the US, okay, the death toll would drop by nearly 16% for COVID. So it's all about, it's a numbers game for sure. But the take home point is that mask use, it reduces the risk of transmission by about at least 30% or more. And of course, the data varies based on the type of mask, how they're worn, and all of those things. But the general answer is yes. And they're one of the only tools we actually even have for COVID, in order to stop widespread so infection. So it's yes, they are working, and yes, we should continue wearing them. And the data is absolutely in support, and shows that it is helping to still very much so curb the spread. But we need more people to be wearing them in more places for it to, again, decrease those transmission rates. And of course, then the frequency that it's going to put someone in the hospital.
Right. Right. Which then comes around to schools, and we're about to kick off football season, and there's going to be some requirements that are coming from the High School Activities Association regarding wearing masks for spectators and people just taking those general precautions and following the rules. So what kinds of steps can the public continue to take to help keep our schools open? Because we've been really fortunate thus far. And as we resume the extracurricular activities.
Those are great questions. And the public in general can help by adhering to all of the recommendations. So I keep saying, this is a team effort, and our kids and teachers are working so hard to comply so that they can protect you also and to stay in school. So it's only fair to do the same in return. Keeping your kids home when you're sick is obviously a really an obvious one. But to clear up a few questions about that, because I understand there's so much confusion, and we've, nobody's ever been in this situation before. So it is tricky. So to clear up a few questions regarding students and testing, we want to emphasize that because, and only because, we're wearing masks in schools and distancing in the classroom, we're not having to quarantine these huge groups of students. However, in higher risk situations, such as, contact sports or even social activities that are higher contact out in the community, the chances that exposure will result in a school and then get into the school, hence causing an outbreak there, keeping that in mind, the chances of that happening go up every time that your kid is getting exposed in a high risk situation. So just keeping that in mind, it's okay to send your kids to their friends. My kids go and have play dates. It's, we're back to that point, especially now where we are in Protect Our Neighbor. They can participate in sports, you can live your lives, but just take common sense precautions. Wear a mask still when you can in public, encourage good hand hygiene, all of those things. And that'll go a long way to help keep our kids in school.
Mm-hmm.
So, I'm so sorry, Nikki. I said testing. I did want to clear up a quick thing about testing kids, if that's okay.
Yes.
We get a lot of questions about this. So we do recommend testing for symptomatic kids to rule out COVID, but as long as there's not been a close contact exposure. So it's all about exposure risk. Mm-hmm. So if there's been a negative test, say your kid has nasal congestion, there's no known exposures, we do a COVID test and it's negative, then your kid can go back to school once they're recovered and they haven't had a fever. So just like in a typical year, but that does not apply to known cases and exposures. Okay, so the test is only useful when the test really just tells us if it's COVID, if it is, we can stop the spread of it. And also it's a good thing to have in terms of healthcare,
if your child gets sick. But the primary value in a test, it's not a ticket back to school or work. It's to ensure that an outbreak won't occur. So, and then of course to safeguard your children's health. So it's always okay to just stay home and quarantine. If there's a known alternative diagnosis, that's also fine. So I feel like it's a lot of pressure on parents when your kids get sick. And the testing helps us keep on track. So that's why it's highly encouraged and we have it available. But all of it's intended to keep people safe, of course, first and foremost, but it's also part of keeping kids in school and sports happening. It's one of the only ways we'll be able to do that. So I don't want anyone to feel pressure to get their child tested when they're sick. It's totally okay to keep them home, keep an eye on them, take them to their doctor, you know, if they're sick, see if there's a likely alternative diagnosis. But if you do want to test, we recommend it between 5 and 7 days after an exposure. But obviously, if you have symptoms and we're not worried about an exposure, then we can test them right away. And turnaround time is about 2 to 3 days right now. So it'll give us a good piece of information to either, you know, make sure that we do contact tracing and stop it if it is COVID, and also to know that if it's not COVID and the test is negative, although the negativity rates can be false, or I mean the negative results can be false negatives, it's still very encouraging that it's not COVID, and therefore, as long as there's no fever, we can get them back in school. So,
Okay.
I just wanted to clear that up a little bit for everyone.
Okay, yeah, because there have been some questions about that. So our restaurants, our groceries, our convenience stores, we're pretty much open now under Protect Our Neighbor, and pretty much everything's opened up following the guidelines from the state. There are businesses that are required by law to comply with the state mask mandate, regardless of local opinion. What's helpful for people and what's not? There's also businesses that just are being cautious for their own personal health and their own sake. So how can we better encourage people to comply with those requirements or those requests, even from our local business partners and friends and family?
That's such a great question, and I think there's definitely a good answer for that. So of course we are shooting for more local control on this issue, and that's been something that all along has been a goal for the state to be able to allow more local control over these guidelines. However, the legalities surrounding the mask mandate are really irrelevant in terms of my public health recommendations, and so I like to separate the two. So if a business is requiring masks, you're exactly right. They're doing it to not only protect themselves, but their patrons. They're doing it to protect you. So it's like if you went into someone's house, I can't remember who gave me this analogy, but I love it. If you went into someone's house and they asked you to take off your shoes because they didn't want mud on their carpet, you know, who cares if it's because they paid a lot for the carpet, or who cares if it's because they're germaphobes and don't want dirty shoes on their floor? It doesn't matter, right? Maybe they have a baby that, you know, comes over, they babysit and crawls on the floor. You wouldn't even think twice about taking your shoes off. You wouldn't even challenge them or ask them why.
Mm-hmm.
So we need to be supporting all of our businesses during this time for lots of reasons, but of course it's your choice, but it's also important to understand that your actions may have consequences that result in worst case scenario, loss of life, but also, you know, loss of a livelihood for a business. So this is why businesses are choosing to comply. When they do choose to comply, it's for everyone's benefit. So, and our board of commissioners supports people's ability to, you know, make that personal choice, but they also support our businesses' right to make these decisions also, you know, in an effort to protect their patrons and livelihoods. So I love that question, because I think if you just step back and think about it from a common sense perspective, it's an easier question to answer.
Yeah,
So.
that's a perfect analogy for that. Just out of common courtesy, basically respecting somebody else's wishes.
Right.
We've been really fortunate to have very limited transmission, no hospitalizations, no known deaths. I think there's probably a concern that we might get a little lax or start to slack off and think, oh yeah, this isn't, you know, this isn't coming here. This isn't really, you know, we're not seeing it. It's not in our face. We still need to be taking those precautions and being aware that this is still out there.
Definitely. And, you know, it's not over yet. And remember, I remember back when we had the discussion about, or I gave a presentation, I think, about case fatality rates and what that meant. It was so hard at the beginning because we just didn't know how dangerous, obviously, COVID was. We didn't know a lot about it, but our knowledge is only good as our data. So obviously, if you have a higher denominator, your percentage gets smaller, denominator being the number of tests you're performing. So this is why epidemiologists measure the deadliness of a disease in many different ways. There's case fatality rates, mortality rates, infection fatality rates. So which ones matter and what is so special about COVID? And what the answer to that is essentially the most current case fatality rate is still at 3% in the US, and the infection fatality rate, may be equivalent to the seasonal flu. But remember, we already have anywhere from 300 to 700,000 people worldwide dying from the flu each year. So overall, though, is with COVID is much more infectious than the flu. It spreads faster, so more people are going to get it. So we're already at 1 million from COVID deaths worldwide. So if people can, the numbers, are they important? Sure. But don't get hung up on the percentages and the fatality rates, because the reality is more people are dying. Overall, a higher transmission rate leads to more infections and then more cases and eventually more deaths. So it's there all of a sudden now the case fatality rate percentage ceases to become this political tool to try to convince people it's not as bad as the flu, just like the regular flu. It's just not as important when you look at it in that way from that scientific perspective. So despite, the implied understood challenges in trying to quantify the fatality rate of any disease, we know that 200,000 Americans are dead. There'll be more. And we know that the virus can cause long-term health effects. And that, unfortunately, we don't have all the data on that yet. And we truly, even though those cases don't get counted as hospitalizations and they don't get counted as deaths, I challenge people to think, if it was you or a loved one, I have a friend who contracted the virus back in March, and she is still wearing oxygen. I rode bikes with her. I raced mountain bikes with her. She's a healthy person, no underlying conditions, but she's got potentially, scar tissue on her lungs and heart problems. I mean, it's really scary. So just thinking about it that way, you don't have to be terrified, but we also need to be reasonable and realize that the risk is absolutely still there. So we need to take the precautions.
Yeah, need to still be aware because it's not going away, obviously. And a vaccine, what's the latest that you've heard on a vaccine from the scientific community?
Oh, actually, that's good news. So currently it looks like there's 3 presentations out there. A couple of them will involve like a 2-dose series. And then there's at least one, I think, that's just a 1-shot and done. So it'll be similar to the flu vaccine in that they'll likely have to continue to update. You'll need to continue getting vaccinated as the virus mutates. But hopefully, eventually, of course, it will be something we just get vaccinated with, for alongside the flu, and we'll have that overall then achieved community, not resistance. Now I'm just blanking out. Herd immunity eventually with a vaccine. But as far as where we are on it, it looks like we may start seeing some doses shipped out to states for high-risk populations by the end of the year. Definitely, probably for the general public, we're going to be looking at the spring. So there's definitely not, even though you hear we may have some by the end of the year, that would be for very specific and limited populations. So we'll see how that goes. I don't know for sure that will happen by the end of the year. Hopefully it does. But then next spring is when we'll be planning, hopefully, to do, mass vaccinations with a drive-through at the fairgrounds. So there you go. We'll hope that happens sooner rather than later.
Yeah, definitely. That'll make things much better. Okay, I think that's pretty much all the questions that you and I had talked about. If there's anything else that's come up.
I don't think so. That was really good. Those were great questions, and thanks for having me on. I appreciate it always.
Yeah, thank you. And our case count update this week is the same. No new cases in the county, so that's more good news for us. And apparently, we're doing something right. So
yes, yeah, and that's thanks to everybody and our kids and teachers and just everyone in the community, everyone who's doing their part. So thank you.
All right, thank you so much.
You're welcome.
And I'll see you for my flu shot.
Okay, sounds good. Okay. Come on by.
See ya. Bye.